Hi, thank you so much for joining us today for Ridley-Tree Cancer Center's community lecture. Today you're going to be meeting the social work department here, and we are going to be telling you about cognitive behavioral therapy, addressing unhelpful thought patterns through the cancer journey. My name is Amy Shapton. I'm the program manager and social worker here at Ridley-Tree.
My name is Andrea Vasquez, and I'm a social worker at Ridley-Tree.
I'm April Calderon, and I'm also an oncology social worker here at the Ridley-Tree Cancer Center.
And I'm Brooke Sharp, and I'm also a social worker here at the Ridley-Tree Cancer Center.
So before we go any further, let's talk about the foundation of what cognitive behavioral therapy, or CBT, is. CBT is an evidence-based approach that has been shown to be effective in addressing cancer-related depression, anxiety, insomnia, and pain. It is often thought of as the gold standard in treating anxiety. That being said, anxiety is one of the most common reported symptoms that we encounter when we're working with our cancer patient population. Looking at the framework of CBT, this approach emphasizes the significance of how our thinking affects the way we feel. CBT is built on the foundation that it is difficult to just change our emotions directly. The goal of CBT is to change our emotions by first changing our thoughts and behaviors. Many of these thoughts are often unhelpful. So we also refer to these throughout this presentation as cognitive distortions. The goal when working with cancer patients in a therapeutic setting who report that they are struggling with things like anxiety and depression is to help them to develop the skills to be able to recognize, counteract, and better manage their unhelpful thoughts and beliefs. These cognitive distortions are not only unhelpful to us, but are oftentimes inaccurate and not based in reality. So now let's take a look at the many different common cognitive behavioral distortions. So here's a list. Let's take a look at this list of common unhelpful thought patterns. First off, I want to normalize that you may be able to identify with several, if not all, of these unhelpful ways of thinking, and that is okay. Our aim here is to help our patients develop the skills to identify their cognitive distortions and challenge their validity. So let's go over some of these. All or nothing thinking, the tendency to see things in black and white categories. An example of this is feeling like cancer has impacted your stamina or your strength. And this means your quality of life will never bounce back. Maybe you say to yourself, I'm never going to get back to the way I feel. Another unhelpful thought pattern is overgeneralization, the tendency to see a single negative event as a never-ending pattern of defeat. An example of this is maybe you got into an accident on your way into work, or maybe somebody else that you love or care about has gotten ill. Whatever it is, it's something bad that's happened in addition to your cancer. And you may feel like this is just the story of your life. Maybe you say to yourself, I'm not surprised, this is just my luck. Disqualifying the positive is another unhelpful thought. This is the tendency to reject positive experiences by insisting that they don't count for some reason or another. An example is mainly just discounting your successes, solely focusing on what you cannot control right now, like your cancer, forgetting about all the other good things in your life, like your family, your friends, your career, your pets. There are so many things to be grateful for. I'm not going to go through all of these, but let's go over a couple more. Catastrophizing. Catastrophizing is focusing on the worst possible outcome, however unlikely, or thinking that a situation is unbearable or impossible when really it's just uncomfortable. Maybe you are done with your treatment. You've received positive, encouraging reports from your medical team regarding the success of your treatment. However, maybe you have a new symptom and immediately go to that dark place. My cancer has returned. I'm going to die. This is catastrophizing. Lastly, another big one here are should statements. And really the emotional consequence of living in the unreality of should results in a never-ending feeling of guilt. I should have not done this when I was younger. I should have lived a healthier lifestyle. I should have stayed out of the sun. There are so many things that you can't control, and living in the past is one of them. So these are some really common unhelpful cognitive distortions. Now, let's take a look at a patient vignette to see how these cognitive distortions might look like in real life. Brooke is going to take us through this next phase.
Thanks so much, Amy. So let's take a look at this patient vignette. The patient is Olivia, and she is a 42-year-old female who was diagnosed with stage 1 breast cancer. She's married and has 2 daughters, ages 10 and 8. Olivia first had surgery to remove the tumor, and thankfully, surgery was very successful. All margins were negative, and no cancer was found in any of her lymph nodes. She then went on to radiation therapy, and during radiation, she did develop quite a bit of anxiety. She often wakes up in the middle of the night and can't go back to sleep because she's consumed with worry that her cancer will return and that she'll die. While up at night, she thinks about all the things she did in her younger years that could have contributed to her cancer. She feels a lot of guilt, thinking that she somehow caused her cancer. She also feels a lot of anger at getting cancer at such a young age. Olivia continually has the thought, this cancer has ruined my life. She feels fatigue and assumes that she will never feel well again. So, now that we've learned a little bit about Olivia and her situation, let's take a look at some of the unhelpful thought patterns or cognitive distortions that Olivia seems to be struggling with. So Olivia's recurring thought that her cancer will return and that she will die is an example of a catastrophizing cognitive distortion. Yes, one possible outcome is that her cancer could return, but this is the worst possible outcome to her situation. And it's also the outcome that is very unlikely considering her early stage cancer and her very successful treatment thus far. Olivia also seems to be engaging in all or nothing thinking. One example of this is the thought that her cancer equals death. The fact is, this is not completely true. The vast majority of people who get diagnosed with cancer live long, healthy, happy lives after their cancer diagnosis. Cancer is not an automatic death sentence. Also, her thought that I will never feel well again, this is another example of all or nothing thinking. She may not feel well right now, but that doesn't mean that she won't ever feel well again. Should statements are another cognitive distortion that Olivia seems to be using, and they are almost never helpful. Should statements create anxiety and make us ruminate and think about things that we no longer have control over, things that have happened in the past. So instead of focusing on things that we don't have control over, we need to focus on things that we can control. What can I do today to improve my health and make my situation better? Another unhelpful thought pattern that she seems to be using quite a bit is disqualifying the positive. By only dwelling on the fact that she has cancer, Olivia is not focusing on the fact that, thankfully, her cancer is very early stage, that her surgery was successful, and that her treatment seems to be going really well. Also, thoughts like, this cancer has ruined my life, completely disregard all the other positive things that may be going on in her life, her children, her marriage, her job, her friends, etc. And lastly, jumping to conclusions is another cognitive distortion that we see here with Olivia. When Olivia feels fatigued, she automatically jumps to the conclusion that she'll never feel well again, or that her cancer is maybe returned. When we jump to conclusions, we tend to make a negative interpretation, and it's not only unhelpful, but the vast majority of the time, those conclusions are wrong. So now that we have recognized some common cognitive distortions that Olivia and maybe even ourselves use quite a bit, what do we do now? How do we stop ourselves from thinking those cognitive distortions? How do we lessen them? Well, thankfully, the first step in lessening and changing these cognitive distortions is recognizing them. So, as much as you can, get familiar with that list that Amy showed us before, and just catch yourself when you start to engage in those cognitive distortions. Then, once we become more aware of the unhelpful thought patterns that we frequently use, we then need to take a step back and analyze each thought. Is this thought based in fact in reality? Could there possibly be a different explanation than the one I just came up with? Something called the thought log is a really helpful tool that we use all the time here at the Cancer Center. And it helps us kind of break down those automatic cognitive distortions and analyze those thoughts to see if they're actually based in truth and facts. With time and practice, you can learn to tell yourself more accurate and helpful statements. And this in turn helps to improve your emotions. A gratitude journal is another really helpful tool that we, again, use all the time here. And it can help you change your outlook and perspective, especially if you notice that you tend to be engaging in more negative, pessimistic thinking. A gratitude journal is a great tool to combat the cognitive distortions, disqualifying the positive, mental filter, or magnification and minimization. So if you notice that those tend to be the cognitive distortions that you kind of lean towards, maybe try incorporating a daily gratitude journal where basically you just write down and take stock of all the positives, all the things you're grateful for in your life. Maybe try incorporating that into your daily routine and see if some of those cognitive distortions tend to soften a little bit. Mindfulness-based coping tools are another really big component of CBT, and they can help with cognitive distortions like jumping to conclusions, catastrophizing, and should statements. So mindfulness-based coping tools are things like diaphragmatic breathing, meditation, and guided imagery. Things that calm our bodies down physiologically so that our minds can then follow suit and calm down as well. April and Andrea will tell us a little bit more about these mindfulness-based coping tools a little later on in the presentation. But first, let's go back to Amy and see how someone would utilize those thought logs.
Thank you so much, Brooke. So as Brooke mentioned, the first step in changing these cognitive distortions, and let's look at those again, is recognizing them. Then we can become more aware of what the cognitive distortions that we tend to use the most, and then we can take a step back and analyze each thought. Is this based in fact? Could there be a different explanation than the one that I'm coming up with? Let's take a look now at the thought log, which is a super useful tool that we use all the time. And let's analyze Olivia's unhelpful thoughts and see if they are actually based in reality. So here is the thought log. It looks very simple. You have the date and time, the situation, the automatic thought, the unhelpful thought pattern or cognitive distortion, evidence for those thoughts, evidence against those thoughts, and a rational response. Okay, so first write down the date and time and then look at the situation. We're looking at Olivia's case for this. Olivia is waking up in the middle of the night with anxiety, consumed with fear her cancer will return and she will die. She also feels quite a bit of fatigue and she assumes that she will never feel well again. What are Olivia's automatic thoughts? Her automatic thoughts are that her cancer is going to return and that she's going to die. She feels that cancer is a death sentence, or I will never feel well again. What could be the unhelpful thought pattern or cognitive distortion that she's using here? So these are examples of catastrophizing, all or nothing thinking, and jumping to conclusions. What is the evidence for these thoughts? Could her cancer return? Could she end up dying from her cancer? Yes, this is one possible outcome, but it's the worst possible outcome for her situation. What is the evidence against this thought? The evidence against this is that it is also the outcome that is most unlikely considering her early cancer stage and her very successful treatment. Cancer doesn't always mean death. The fact is, the majority of people who get diagnosed with cancer can live healthy lives. A rational response to this would be, it is normal to have anxiety and fear at times. That is common after going through what you've gone through, a cancer diagnosis and treatment. It is important to remind yourself of what your medical team is assuring you instead of focusing on the fear and unknown. Another rational response to her feeling fatigued after all of her treatment is that she may not feel well right now, but that doesn't mean she's not ever going to feel well again. So let's break this down even further. Another situation Olivia is experiencing is while she's up at night, she's thinking about all the things that she did when she was younger that could have contributed to her cancer. She feels a lot of guilt, thinking that she somehow caused her cancer. And, she's got kids, so this is a normal thing to sit and think about. She also feels like cancer has ruined her life. What are the automatic thoughts? Her automatic thought is that what she did when she was younger caused her cancer. And another thought is cancer has ruined her life. What are the cognitive distortions here? Should statements are a part of the unhelpful thought patterns. She is also disqualifying the positive. What evidence is there for this? There is nothing in this vignette that can lead us to provide any validity to this thought that she has caused this. All we know is that she is young, has early stage cancer. This could have had genetic or environmental influences. There's not always a clear-cut answer when you're dealing with cancer. What is the evidence against these thoughts? Thoughts like cancer has ruined my life disregards all of the other positive things in her life, like her children, her marriage, her job, things that bring her joy. In regards to her feeling like she caused her cancer, living in the past breeds anxiety and makes us perseverate and think about things we do not have control over. Instead of focusing on things we can't control, a more rational response would be we need to focus on things we do have control over. What can I do today to improve my health? What can I do today to reduce these feelings of anxiety? Being grateful for all the positives we have in our life is an example of this. Keeping a gratitude journal, doing relaxation techniques. So I hope you enjoyed learning how to use this thought log today in order to counteract cognitive distortions. As Brooke mentioned, mindfulness-based coping tools are a huge part of what we use here in conjunction with our cognitive behavioral therapy. They can also help with cognitive distortions. Today, we are also going to talk about mindfulness-based coping tools, specifically diaphragmatic breathing and guided imagery. April Calderon and Andrea Vasquez will tell us a little bit more about these mindfulness-based coping tools, as well as demonstrate for you how to use them. This next piece I'll hand it over to April Calderon. Thank you so much.
Thanks, Amy. During times of crisis, breathing tools can help us reduce anxiety and stress. One breathing technique, diaphragmatic breathing, can help us release tension and relax. Before I demonstrate this breathing technique, I think it's helpful for us to understand the body's normal response to stress. When we experience stressful situations, our body releases cortisol, a stress hormone which escalates the central nervous system and often triggers a fight or flight response. When this happens, we might notice changes happening within our body, like our muscles tensing, our palms sweating, our heartbeat accelerating, a faster pace of breathing. And so finding techniques that help ground us can bring us back down to our baseline. Diaphragmatic breathing is a powerful tool that can help de-escalate the body, bring our breaths back down to a relaxed state, and improve our overall levels of awareness. This breathing exercise can be learned within minutes, and the benefits can be experienced almost right away. So I'll go ahead and get started with the exercise, and Amy will help with demonstrating. To begin, it's helpful to be in a comfortable position, whether that's sitting or lying down or even while you're standing. It's also helpful to place one hand on your chest. So Amy, you can place one hand on your chest and the other just beneath your rib cage, but above your diaphragm. And this will help with guiding your breaths. To inhale, slowly breathe in through your nose, drawing your breaths downward towards your stomach. Your stomach should push upward against your hand while your chest remains still, and hold that breath for a moment. To exhale, tighten your abdominal muscle and let your stomach fall downward while exhaling through your mouth, and your chest should continue to remain still. Inhale, slowly breathe in through your nose, drawing your breath downward. Hold for a moment. To exhale, tighten your abdominal muscle and let your stomach fall downward as you exhale through your mouth. Slowly inhale in through your nose. Breath goes downward. Hold for a moment. Exhale out as your chest continues to remain still. Inhale in. Hold for a moment. Exhale out. Inhale in. Hold. Exhale. It's helpful to practice this exercise for about 3 to 5 minutes at a time, and that's diaphragmatic breathing. We'll now transition over to Andrea with guided imagery.
Thanks, April. So guided imagery is another one of the techniques that we use at Ridley-Tree Cancer Center to help patients who are experiencing anxiety. So it works by having the person imagine pictures, sounds, smells, and other sensations that can help relax the body and the brain. So really to transport the person to a different space. So the role of the social worker is to guide your imagination to places or situations that will make you feel peaceful, safe, relaxed, and clear. So I'm going to demonstrate a shortened version of a guided imagery exercise, and you can participate in the exercise if you'd like, so that you can experience some of the effects of guided imagery. This particular setting is in a forest, so I'll go ahead and get started. Begin by finding a comfortable position, sitting or lying down. If you feel comfortable and safe to do so, please go ahead and close your eyes. Allow your body to begin to relax as you start to create a picture in your mind. Let the forest visualization begin. Imagine yourself walking on a path through a forest. The path is soft beneath your shoes, a mixture of soil, fallen leaves, pine needles, and moss. As you walk, your body relaxes and your mind clears more and more with each step you take. Breathe in the fresh mountain air, filling your lungs completely. Now exhale. Breathe out all the air, feeling refreshed. Take another deep breath in and breathe out completely, letting your body relax further. Continue to breathe slowly and deeply as you walk through the forest. The air is cool but comfortable. Sun filters through the trees, making a moving pattern on the ground before you. Listen to the sounds of the forest, the birds singing, a gentle breeze blowing, the leaves on the trees shift and sway in the soft wind. Continue to breathe slowly and deeply. Slowly, you become more and more relaxed. As you walk through the forest, feel your muscles relaxing and lengthening. As your arms swing in rhythm with you, you become relaxed and limp. Feel the tension leaving your body as you admire the scenery around you. Your legs and lower body relax as well, feeling free. Tall trees grow on either side of the path. Picture the variety of trees around you. You admire the rough, brown bark of pine trees and enjoy the fresh pine scent. Smell the forest around you. The air is fresh and filled with the scent of trees, soil, and mountain streams. You can hear the sound of water faintly in the distance. Listen to the birds singing. Hear the stream flowing, the leaves rustling in the breeze. See the flowers, trees, valley, and mountains around you. When you're ready to leave the peaceful place, slowly begin to reawaken your body. Know that you can return to this forest in your imagination whenever you like. As you reawaken, keep with you the feeling of calm, peace, and relaxation. Wiggle your fingers and toes to wake up your muscle. Shrug your shoulders. Stretch if you'd like to. When you're ready, open your eyes and return to full wakefulness, feeling alert and refreshed. So as I mentioned, this is an example of a shortened version of guided imagery. The great thing about guided imagery is that it can be really tailored to whatever the patient feels would be comfortable for them. For example, the patient prefers a beach setting if they find that comforting and relaxing. A therapist can find a beach guided imagery exercise and really guide them through that. Ideally, it's practiced daily, and I think the great benefit of guided imagery is that it can be done in a car before an appointment. It can be done before going to sleep or when you wake up. So if you'd like to listen to a longer version, feel free to visit our website. We have some great resources on there. So this concludes our presentation on cognitive behavioral therapy. Thank you so much for taking the time to learn about CBT. We strongly believe in the benefits of CBT, and we see how it helps patients get through their cancer treatment. If you or someone you know would like to get in contact with our team, please refer to Rosario, our administrative assistant, and she can help you in getting in contact with our team. Again, on behalf of the Social Work Department at Ridley-Tree Cancer Center, thank you so much for joining us.